This promotional podcast has been developed, organized and funded by Nutricia for UK healthcare professionals only. The content has been reviewed and approved by Nutricia prior to broadcast, with editorial support by OmniMed Communications. Any views, opinions or recommendations expressed in this podcast are solely those of the speaker and do not necessarily represent those of Nutricia. Welcome to the podcast titled What Support is Available for Managing Cow's Milk Allergy? Real-life Insights from a GP. Hi everyone, my name is Nishti. I'm a specialist pediatric dietitian and I work in private practice. Today I am joined by Helen Evans-Howells, a GP and allergy specialist. Dr. Helen qualified with honours from Southampton University in 2005 and then trained as a GP, completing this in 2015. Helen became interested in allergy due to her own experience of managing a child with milk and nut allergies. She undertook the Masters in Allergy at Southampton University and qualified with distinction in 2018. After working with the allergy team in Southampton Hospital for almost 5 years, Helen now runs a private allergy clinic, Dr. Helen Allergy, which provides virtual and face-to-face allergy consultations. Dr. Helen lectures extensively across the UK and internationally and has the only community clinic outside of London which offers food immunotherapy to children under 6. She also helps to run the peanut immunotherapy clinic at Southampton Hospital. She's a trustee for the Anaphylaxis UK charity and has appeared on various shows such as Channel 5 and BBC Radio. In this podcast, we'll be talking about some practical considerations of managing suspected cow's milk allergy in primary care, as well as some useful resources. Hi, Dr. Helen.
Hi, Nishti. Thanks for having me today.
So pleased to have you here.
I'm happy to be here.
I've got so many questions, so should we just dive into it?
Sounds good.
So, should we start out with what are some common mistakes that you see in practice as part of cow's milk allergy management?
Sure. I thought I'd separate this section into difficulties around assessment and then treatment. And I think the first thing to say is, this can be quite a challenging topic. And being GPs, we get very limited time with patients. So just on average around 10 minutes versus privately when sometimes this will take me a whole hour and I get the luxury of time. So nobody, I think, should ever feel criticised by some of the things that I'm going to suggest. But I think the first thing when we're thinking about assessment is it really is beneficial for the patient and their onward journey and your relationship together if you can invest time in the consultation, even though we've just discussed how challenging that is. So the really important thing is to make that parent feel like you are listening to what they're saying and so that they go away feeling heard. Otherwise, I find what happens is that people feel that they can be quite dismissed, particularly if you lead with the question, is this your first child? Because whether or not you meant it, they take away from that you're just feeling like they're a first-time mum with no experience. And then what tends to happen is people go online looking for help and often get inaccurate advice. So do spend time looking at the photographs that the families will provide, the food diaries, hearing their challenges, because it really can be quite a difficult path to navigate. I think be open-minded about the possibility that this is allergy, but also keeping in the back of your mind that potentially there may be other diagnoses. So if things are not improving in the way that you think that they should be, maybe considering, actually, is this an allergy at all? Is it possibly that they may have reflux? Could they have tongue tie? Is the breastfeeding attachment not right? Is this a child with quite a sensitive gut? Thinking all the time, am I missing something? And, using the opportunity in primary care to always reassess. So that would be one of my top tips. Keep the door open, encourage them to come back for assessment, and make sure you keep an open mind about what might be happening.
Thank you. I think being listened to is such an important point because often parents mention that, and I hear that myself as well. But it must be challenging for GPs, when you have 10 minutes. How would you suggest that you can listen to a patient if you have 10 minutes?
I think it's all the skills that we are actually really good at in primary care. I think that families do like to see that you are looking at the pictures they're providing and the food diaries. I know personally that I don't spend a lot of time looking at food diaries actually, because I want the consultation notes from, I want to listen directly to what they're saying rather than seeing it all written down. But families, if you just disregard it, feel that they've spent a lot of wasted time reflecting back to them. So I hear you saying X, Y, and Z, and empathizing. And whether or not you feel that there is truly an allergy here or not, their lived experience is that things are really difficult right now. So I think just reflecting that back to them is really important. Otherwise, I feel that you lose them at the beginning. And then when you are trying to implement strategies that are appropriate, such as recommendations about breastfeeding or which formulas and how long they need to stay on them, you lose their trust and they won't follow your plan. And I hear quite often from patients, like, I just told the doctor I did that, but I didn't really. And that to me tells me that you haven't gained their confidence.
Those are excellent points. Thank you so much.
The next section then I would say is around the treatment difficulties that I see. So breastfeeding is always a very hot topic. We know that it brings with it a lot of benefits, and it's always a really personal decision to decide, do I breastfeed? Can I breastfeed? Am I continuing on? And it's really important when someone presents and you think that child has a milk allergy, that we support that family to continue to breastfeed, or the mum to continue to breastfeed. Far too often I hear still that mums are being told that with an allergy you can't continue breastfeeding, you must stop straight away and put them on formula. And that really isn't the appropriate management. We would be giving breastfeeding mums specific advice about cutting cow's milk out of their diet and perhaps other allergens like soya, making sure that mums have the appropriate nutrients that they need, so recommending calcium and vitamin D supplements, but reassuring them it's not their fault and that they can continue to breastfeed if they want, and that actually that is beneficial is crucial. Then I see difficulties around prescriptions of formula. So when people are prescribed formulas, I think that part of the problem is that those families are not told at the beginning what to expect. So the key things are explain to them that it can be quite challenging to convert children onto prescription formulas because of taste. So what could you do to change that? Can you sweeten the formula? Can you titrate slowly across? Explain to them that for most people, this is not going to be an overnight fix. And if you don't explain that at the beginning, then all that will happen is you'll get a phone call the next day telling you that this hasn't worked, because they almost expect it, to be a wonder drug, which is not, how these things work, that it takes time for the inflammation in the gut to settle. But if you don't explain that to families, they don't know what to expect. And when I look at prescribing audits, far too often, as you probably know, you have families switch very quickly, babies switched from extensively hydrolyzed formulas to amino acid formulas within days, which is not the recommendation from guidelines. It would be at least a 2-week trial to see whether things have got better. So make sure you explain to families what the expected pathway is of, this is going to be quite tricky for some babies to take. These are the tips to sweeten it. This is how long it might take for improvement to be seen. The stool will go all manner of colours, including green, and that's okay as long as we're not seeing blood. And then families will understand what journey they're taking, and we won't be swapping to more expensive prescriptions that have their own difficulties with them. So those are the main difficulties I see.
The psychological burden of cow's milk allergy for parents and caregivers is well recognized. Do you have any advice on how to support these parents? And I would be curious to hear how you support them as well in your clinical practice.
Yeah, it is really well recognized. The impact of food allergy on the patient, obviously in this setting, we're talking about babies usually, so not so much them, but on children and young adults and the families themselves. And it is well recognised within the allergy community how difficult that is. But actually sometimes, unless you've lived that experience as a doctor yourself, you don't realise how hard it is for these families to navigate the cost of living crisis, more expensive food prescriptions, the worry about giving these children milk, the anxiety, the guilt. So recognising it's a problem is the best first step. empathizing with them and saying, like, this must be really hard for you, because people really do feel quite unsupported. And unfortunately, there isn't very much help around in the area of managing the anxiety associated with food allergies. So if you can see that this has had a massive impact on the parents, then perhaps it's worth referring them on for some more psychological support with things like, in our area, it's called Steps to Wellbeing, but there'll be different names for it across the country, but making sure that those parents can access support. Personally, in our business, we work with clinical psychologists who specialise in food allergy because they are crucial, because it's well recognised what impact this has on people's quality of life.
Thank you, Helen. So what resources are available to support healthcare professionals and parents and caregivers? Is there anywhere you can recommend that we start?
Absolutely. Well, obviously, being a trustee for Anaphylaxis UK charity, I'm going to recommend them, but also the other well-known allergy charity, Allergy UK. So both of those charities have got fantastic resources for both healthcare and patients. So I think it's really important to signpost people to those resources. And Allergy UK do have a lovely one called Cow's Milk Allergy, the Roadmap for Parents. So it will really go through the journey. I was involved in overseeing that article. And it explains, what the symptoms might be, the expected progress, how to navigate things like the milk ladder. Because in our very short consultation time, what will often happen is we'll kind of throw a milk ladder at them or tell them to Google it. And then what you find is that people have no idea how to navigate that. And if we're honest with ourselves as doctors, probably we don't either. And so it's making sure that we access the appropriate support for those patients, referring on to a dietitian. Personally, I follow quite a lot of dietitians online, yourself included, Nishti, because you will share quite often the IMAP milk ladder, but along with tips for how could you adjust the recipes, what are the shop bought equivalents, what do you do if you're milk-free, egg-free, wheat-free. Those nuances around trying to put the food back in really need specialist dietetic support, which is quite limited in the NHS, unfortunately. So as long as you know that you're directing somebody to a kind of validated resource like you guys online, following guidelines, then I think that's okay to do. And the reality is our patients are on social media and looking for advice there. So let's send them to the right channels.
Oh, excellent. Thank you so much. So from your perspective as a GP, what do you feel are the key considerations when seeing suspected cow's milk allergy patients in primary care?
Good question. So I think consider the diagnosis, be open-minded, have milk allergy on your radar. If a baby has presented with their parents multiple times to a variety of settings, often for me that raises my hackles that this may well be a milk allergy if they are presenting to lots of places. But as I've said, always consider other diagnoses if things aren't improving. If they're breastfed, involve a breastfeeding advisor. Make sure that things have been ruled out, like a shallow latch that, sometimes can actually put blood in the stool. Tongue tie's been ruled out. One of the big things I see, and one of the top tips would be make sure that you've documented their length and their weight to actually identify if these babies are growing adequately. Far too often that's missed. And then finally, my top tip would be to set expectations for the family. So to explain what is the journey that they could be expected to follow, what's the likely time frame of improvement, and when should they come back to access more help.
I think that's an excellent top tip.
Yeah.
And we all love top tips, and I wonder if we should round up the podcast with some more top tips for our listeners, if you have, even if it's rounding up on what you've said so far, just some take-home messages.
Okay, so my top tips are, when you're thinking about delayed non-IgE mediated cow's milk allergy, these children and babies usually present with more than one symptom. So be looking for that pattern recognition. I always say, what's the skin like? Have they got reflux? What are their bowels like? What's their length and weight like? So put the whole picture together to come up with an accurate diagnosis. Think about the most appropriate feeding method for that baby and support them with that journey. Give them tips of how to make sure that the formula is accepted, either by titrating across or sweetening up the formula. know when to review and when formula changes might be needed. And then my crucial top tip is trying to get the cow's milk back into the diet early. We used to leave this quite a long time. So really, from the age of 1 and over. And now, particularly with immediate allergies, but obviously this may need more specialist advice, I'm really thinking about, can we get baked milk in sooner rather than later to try to help build some tolerance? Because I really do see milk allergy seemingly persists for much longer these days, which is a bit of a worry because milk is very challenging for families to avoid. And my final top tip is to always ask for help. Find a friend and ask for help. Working in secondary care and primary care, I can tell you that allergy consultants are more than happy for you to pick up the phone and ask for advice. As I know you as a dietitian would also say, we know that waiting times are very long and that it is difficult for less experienced colleagues perhaps to manage this and for their patients to find their way. So please, if you're struggling, ring through, ask for advice about what to do, and we would be more than happy to guide you. Likewise, I'm happy if people ever want to reach out to me. I give advice all the time.
Excellent tip. Thank you so much, Helen. Thank you for listening to this podcast today. I really hope this discussion is useful to you and hope that you're able to take these insights on the management of cow's milk allergy in primary care and apply them in your clinical practice.